I love that technology.
Good evening. My name is Lacey Whedon. I'm the Director of Parent Friendly Programs at Georgia Tech. I would like to welcome you tonight to tune in to learn a little bit more about our health and safety topics at Georgia Tech. This session is being recorded and we will place it on our website next week should you have a friend who wasn't able to attend tonight or need to watch it later. I'm going to introduce our speakers and then we'll get into the PowerPoint presentation that we have, and then we'll do question and answer at the end. So I see some of you have already started in the chat box. We will try and get to as many questions as we can this evening. So our first presenter is Chief Connolly. Chief Rob Connolly is the Chief of Police at Georgia Tech. He leads the Georgia Tech Police Department, is responsible for the safety and security of the Institute, as well as the strategic direction of the department. And Dr. Ben Holton serves as the Senior Director of Stamps Health Services. Dr. Holton supervises board-certified personnel that are experienced in the treatment of college-age students. And the areas that they provide service for are primary care, psychiatry, women's health, travel, immunization and allergy, sports medicine, pharmacy, laboratory, and radiology services. So we're going to pull up the PowerPoint right now, and we'll get into our first presentation by Chief Connolly. Just one second.
Is it up?
Not yet. It's coming up right now. There we go. All right.
And I'll let you know when to change the slides, Lacey. You'll drive for them? All right,
Yeah,
great.
Tyler will change them for you.
All right. Welcome, everyone. I'm Chief Connolly, and I'd like to go over a brief presentation on safety on campus. I'd like to give a quick overview of GT and answer some questions about some of your concerns for the week of, coming, and then we'll answer those questions, as Lacey said. Next. All right, real quick, this is our location. We're on the corner of 10th and Hemp Hill. We've got a snazzy, great new facility, lots of space. Please come visit us. Next. All right, one little quick reminder that we're an accredited agency, state certified officers, and we meet all the national law enforcement standards like most municipal agencies. And there's only 2 in the state, community colleges that actually meet these accreditation standards. Next, I'm going to slip through some of them. This is our org chart. Next. So we have 90+ sworn officers, and this is how the police department's broken down. We're funded for 138 staff personnel. So just like any local municipality, we have 6 command staff members. We have multiple officers that are on patrol, 9 specialized units, and then we have K9 units that are all explosive dogs, and we have our own communication and 911 center. Next. Situational awareness on campus. This is our communication and our operations center, how we monitor and track all safety on campus. The dot map you see on the right with the orange lollipop dots, those are exterior cameras we have all around campus to monitor activity on campus, make sure our campus is safe. And the situational awareness platform was developed by yours truly, Georgia Tech students. Cameras on campus, we have 3,500 high-resolution camera views on campus. That's everywhere on campus, from exterior to interior. This is how many camera views we have to monitor the safety of your students. The 21 license plate recognition system. This is where we actually can read every plate that comes into campus. If someone's plate is either wanted or is a stolen vehicle, every pole coming into campus has a license plate recognition system. This is a way that we can, one, maximize our visibility and maintain a good surveillance of the whole campus. And of course, we have portable camera platforms, and then we also have vehicle cameras, and of course, body-worn cameras for all the officers. So, as you would hope, we're on the cutting edge of technology maintaining the safety of this campus. Next. As I said, we have specialized units. We have explosive K9 units that we deploy on campus. We have a behavioral threat assessment team. We'll give you a quick brief on some of the threat stuff for this upcoming events planned down near the Capitol. And then we have all your specialized teams as you would need, from physical security units to campus outreach units. Next. How do we notify students and parents of events on campus? GTINs is a form of notification when we want immediate action from students. We have from everywhere from text messages to voice messaging, even outdoor sirens. We have 7 outdoor sirens, and if we want immediate action from students, we have lots of tools to work on to actually make emergency notifications to students. And this is where we communicate out what actions we want students to do based on any type of situation. The campus safety alerts. These are the timely warnings. You get emails that go out to the whole Georgia Tech campus, and that's based on any crime or any kind of active threat that students might face in the areas around the Tech community. And then for parents, we have our GT Twitter account, and then we have LiveSafe. Let's talk a little bit about LiveSafe. Next. On more communications. So this is our number. If you don't have it, it's 894-2500. Our dispatchers have worked 24/7. Call boxes are pre-positioned all around campus. We have 900, close to 900 call boxes strategically placed all across campus. It's almost like Starbucks. You can see one from the other. That's how they place them. You literally visually can see one of the blue phones from another. And all those directly come right back to the PD. And some of them will have cameras on them now too. And this is how you contact us on the website of GTPD. Next. LiveSafe. LiveSafe is an app our students have become very comfortable using, normally during FACET. It's a great opportunity. We get parents to talk to their students directly to be sure that they have our safety app on their phone. The safety app gives us lots of features. One, they can communicate us through text. They can send us video. And then students can actually connect with us anonymously. They don't have to give us their information. The great thing is lots of other features. There's resources on campus. There's lots of resources on locations of buildings. The app is free and parents can download it. It goes on iPhones and Androids. So take advantage of the app. It works very well. We've had it for about 4 or 5 years now, and our students are active. We have anywhere between 6,000 to 7,000 students that use it, and it's pretty active. They give us all information. They text us and send us videos. Again, parents can have this. It also connects to other schools. Since we've had the app, Georgia State has it, UGA has it. So if you have a student in another state school, most of our UGA partners, our SGA partners have the app too. Next. Canines. We have 2 snazzy dogs. They have, unfortunately, have more likes on social media than we do. The dogs are very popular on our social sites, and the dogs do a great job for the community. Next. All right, let's get right to the civil unrest and what our concerns are for upcoming events. So the big thing everyone's concerned is a lot to do with what's going on in the media, what's happened at U.S. Capitol. And they also called for action on all state capitals. Wednesday at 1 o'clock, myself and our threat assessment, who's in the office with me now, went to an intelligence briefing with the FBI that just gave us some general information, exactly what you see on the news. It's a general call out on the 17th to all state capitals. There's no direct information or intelligence information saying Georgia or what state. It's just a call for action to all state capitals. And that's why if anyone goes by our state capital, it's pretty fortified right now. So you've got to call out to all the state capitals to protect, and everything going from Sunday to Wednesday for the inauguration. So all the agencies from Atlanta to GSP have been putting their plan of actions together. We've all met, and we're very clear on how this plan of action we carry out. Let me tell you how Georgia Tech Police plays a role in that and how we connect to make sure our campus is safe. So there's a joint operations center in downtown Atlanta with all the joint agencies combined in that operations center. Lauren happened to be our intel officer who stays in that operations center and gives us situational awareness of what's going on around us. If it's happening at the Capitol, anywhere at all, it lets us know real time what's happening and gives us video feeds back, and it's in the video integration center, and it gives us all that information, intelligence information to know what's happening anywhere near our campus. Okay. Our regional response plan. We planned right before the inauguration, before the election, and we planned for all scenarios. And one thing we found out with the Board of Regents, we have lots of resources between myself at Georgia Tech with that 90 plus officers, Georgia State University, and Kennesaw, and we combined and did a regional response plan where we combined close to 300 officers to respond to each other's needs. So as you know, Atlanta might be busy and might have a staffing resource concern. We can self-contain and make sure our campuses have enough resources to respond to each other. So that regional response plan worked very well, and we activated for Sunday throughout the next week. So all of the schools will work together very closely, met with Georgia State today, and we'll balance resources. And on our campus. So on our campus, we're going to increase our security measures throughout this week to make sure nothing happens on campus. We're increasing our visibility of officers, make sure we're out and about so students feel safe as we watch the news. We're also increasing our awareness of suspicious items. Training all our frontline employees, remember about suspicious packages, unattended vehicles. We're really stepping up our vigilance back to where we were post 9/11. And that's kind of how we're going to posture. And then we actively monitor those 3,500 camera views. And believe it or not, we have student workers who help, and we monitor lots of different areas that are vulnerable. And we also work with our partners, with CNN and TBS, and we're assisting them with some sweeps in areas that they may be vulnerable during this time. So this is our plan of action. We've got the resources and all the support from the administration. And I again repeat, the intelligence information is very vague, nothing directed towards Georgia, mainly directed towards the Capitol and the government, and not towards individual schools. Okay, and then I'll let, I guess that's it for my presentation. I'll go to Dr. Holton, and then we'll take questions.
Good evening, everyone. My name is Dr. Benjamin Holton. I am the Director of STAMPS Health Services. I wanted to start by giving you a brief overview of STAMPS and the services that we offer at STAMPS. We have several clinics at STAMPS. The largest is primary care. Primary care provides services for things like acute illness with cough, cold, congestion, for acute injuries, sprained ankles, injured shoulders. We can do minor procedures such as laceration repair, drainage of abscesses. We can relocate dislocated joints that don't require sedation. And we also provide preventative services such as routine physical exams, STI screening, and we manage chronic illness as well. Women's Health Clinic provides services to women, including contraception, assessment of acute gynecologic complaints, and also counseling regarding birth control and things like that. Our Psychiatry Clinic provides medication management for psychiatric illness and works closely with the Georgia Tech Counseling Center in managing students who have mental health issues and need support in that area. One of our providers is also board certified in sports medicine and runs a sports medicine clinic a couple of afternoons a week. We have a travel immunization allergy clinic where we provide services such as immunizations that students need to complete their requirements, immunizations for travel, and also allergy shots are offered to students. We do not do allergy testing, so a student has to have been to an allergist first and have established a routine with their allergy shots before transferring those to stamps. We have an in-house pharmacy where students can get their prescriptions filled. Those prescriptions do not have to be written by us at Stamps. Their home physician can also send prescriptions to Stamps and have those filled. And then we offer lab and radiology services. We do not have CT or MRI or ultrasound. The radiology services that we offer are regular x-rays. And then our laboratory services includes in-house tests like a mono test, a strep test, a urinalysis, a pregnancy test. And then we are also doing COVID testing for symptomatic students at Stamps Health Services. The test that we do is a rapid test. We get our results in about 30 minutes, and that helps us make a decision about whether a student needs to be put into isolation or not as soon as we see them. We don't have to wait 2 days to get a result for that. In terms of other activities that are occurring on campus, Stamps plays a vital role in the testing strategy that Georgia Tech has developed. It's a multi-pronged strategy for testing students for COVID-19. Our role is the symptomatic testing. The larger portion of our testing strategy is the asymptomatic surveillance testing that has been developed and is run out of one of the research labs at Georgia Tech. We have sample collection sites scattered around campus. The sample that we run our test on is a saliva sample, so it's relatively easy for students to provide a sample to be tested. We have done over 150,000 tests on our students in fall semester, and we've seen our surveillance testing program prove successful in terms of keeping our rates of COVID-19 relatively low. We started the fall semester with a moderate-sized spike in cases. We were able to use our testing program to get students in isolation and to focus our testing efforts on areas that seem to have higher infection rates. And by doing so, we were able to get our infection rate down to quite low and maintain it at a very low level until the end of the semester. Again, we had a small spike at the end of the semester, but we're able to get that under control with focused testing as well. In coordination with our testing program, we have a contact tracing team that reaches out to students who have tested positive, gives those students instructions for going into isolation, and gets a list of contacts for that student that we then reach out to and help those students get into quarantine to interrupt the cycle of spread among students. And the same is true for faculty and staff. Faculty and staff are also part of the testing program and also the contact tracing program. Georgia Tech does offer isolation and quarantine space for students who live in Georgia Tech housing, and that we've also extended that to students in Greek housing as well. Another part of our efforts to control COVID on campus this semester is the deployment of a vaccination program. We do have COVID vaccine at Georgia Tech. We have initiated a vaccination program this week. We are starting in what Georgia's Department of Public Health defines as phase 1A+. That includes healthcare workers, first responders such as the police department, some critical infrastructure workers. We've included in that our COVID testing teams, and it includes people who are 65 and older and their caregivers. So far, we have been able to vaccinate our healthcare workers, our Georgia Tech police officers, our critical infrastructure, some of our critical infrastructure workers. We've also vaccinated a good portion of our 65 and older group, and going into next week, we will be expanding that group to include caregivers. We've also started vaccinating some of our environmental care workers, environmental services workers. For Georgia, Phase 1B includes educational faculty and staff, and that will be the phase that we move into when DPH states that we can. And in that group will be our faculty and staff. And we would hope that we could get through that group within 2 to 3 weeks. The phase after 1B is 1C, and that will include individuals who are ages 16 to 64, who have a underlying medical condition that puts them at increased risk for severe disease from COVID, and that's where we'll start picking up some of our students who have a underlying illness. And then we will get to the main portion of our student body in phase 2. It's hard to say exactly when we'll progress to each of those phases. We have to go at the pace that Georgia's Department of Public Health announces when those phases, when we can do those phases. We can't get ahead of DPH. So we are somewhat tied to their timeline in terms of those phases. We have to wait on them. We have the capability, or we are working towards having the capability of doing 1,000 immunizations a day. We are currently in the process of getting the staff needed to do that, and should be ready to do that the week of January 25th. So far, we are vaccinating at a rate of about 200 shots a day. And then in terms of strategies that your student can take to stay safe. So one of the most important things that they can do is wear a mask, and they should wear a mask whenever they are not in a room by themselves. From our fall experience, we know that the vast majority of transmission among students is occurring in small friend groups and in informal gatherings. It's not occurring in classrooms. And so your student needs to be aware that when they are hanging out with their friends, watching a movie, eating a meal, they should be wearing a mask. And the other thing that's important is that they avoid large group gatherings and that they socially distance when they are around others, maintaining a distance of at least 6 feet. So we want students to engage with each other, but they need to do so in a safe way. And Georgia Tech is trying to provide a multitude of opportunities for them to do that. They've scattered tents around campus where students can congregate. They're going to be adding heating to some of those tents that are scattered around campus during the wintertime when the weather is cold. We are providing a number of activities that they can participate that are designed to maintain social distance, but to help students connect. Some of those activities are virtual, some of those activities are in person. And then the other thing that students need to do is continue to practice good hygiene, hand hygiene, in terms of washing their hands frequently, keeping their hands away from their mouth and nose and eyes. And if they're doing those things, they stand a very good chance of being able to negotiate the semester and remain healthy. The other thing I would really ask is that you encourage your student to get vaccinated for COVID-19 when we get to the stage where we're vaccinating students. We would love to see a very high turnout among the students. And that's really all I have in terms of presentation.
Okay, great. We're going to take some questions and I will direct them as best I can. It's Lacey again. I'm going to direct those as best I can. So let's see what we have in the chat box here. Well, our first one actually, and Dean Stein is actually on the call as well, and Colleen may answer this, the Associate Dean as well. What mental health resources are available for students during the semester if they are feeling isolated and overwhelmed?
Dean Stein will take this one.
Okay.
Sure. I want to reassure you that we have a full array of mental health support on campus. This semester, we will start the term with 38 mental health professionals that are in 3 different centers: psychiatry, the counseling center, and our assessment center, GT Care. Students can access those online and meet with someone, have a remote kind of teletherapy or assessment done. During the fall term, those 3 centers actually had over 9,200 points of contact with Georgia Tech students. They were averaging at peak times over 500 contacts a week. So they are available. Your students should not hesitate. If you are concerned, then you should make a referral or contact the dean's office, and then we will contact your student and try to make that connection to the assessment center, because that's the first point that students go through, is the assessment center, and then make a referral from there. There are many different ways to get help on campus, and I encourage you to encourage them, and if they're unable to do it for themselves, then please contact us and let us know of your concerns. I also want to say that for this semester, we added 3 new therapists in our counseling center, and we have 1 psychiatrist who's returned from maternity leave. So we have quite a few 4 new staff that we added to the list of staff that were already there in the fall.
Okay, thank you, Dean Stein. Dr. Holton, I accidentally muted you, so I'm going to have you unmute yourself for this question. I apologize. Do you expect, and I don't know that you can answer this question, but I'll ask it. Do you expect to get enough doses of the vaccine to vaccinate all the students?
Well, we sure hope so. We don't have, that is somewhat out of our control. And it depends on the number of doses that are allotted to the state of Georgia, and then subsequently that the state of Georgia allots to us. We received 1,000 doses of the Pfizer vaccine with our first shipment. We have placed an order for another 1,000 vaccinations for our second shipment. I do not have any reason to think that once the vaccine supply opens up, that we will not be able to get the vaccines that we need. And I think we are demonstrating that we are capable of vaccinating our population at a robust rate. So, and our relationship with the Department of Public Health is a strong one. So I don't foresee any reasons why we would not be able to get the vaccines that we need to vaccinate our community.
Okay, thank you so much, Dr. Holton. Chief Connolly, I have a question for you. Will Georgia Tech advise students about the safety risks for next week and what precautions they should take to be safe?
Yeah, well, I think we'll reach out to crime prevention and go online and reach students to give them some basic information. But right now, really, there's not much except for see something, say something, a normal campaign for any suspicious activity to report to us. But I don't see we need students' activity in dealing with this type of unrest. But we will go out and do a normal crime prevention type strategy on letting students know if they see something suspicious to tell us. And use the app and call us everywhere you can.
Okay, thank you. I have another question that a parent asked. Do we have a safe walk program at DT? How do students get it? And I know you touched on this a little bit, but late at night, how do students get where they need to be going?
Okay, the Stingerette, it connects with the app. You can use the Stingerette, and you can get the Stingerette service after hours on campus. And if your student feels they need a ride, they can call GTPD. We give escorts. And believe it or not, even on the app, with a friend, they can watch each other walk. There's lots of features to the app that you could use and have friends watch you walk across campus, and we have an emergency notification to the app. So lots of features to make your student feel safe while on campus. But if they're really concerned, call us and we'll support them. Use the stingerette, and when in doubt, if you don't get the stingerette, call us and we'll escort.
Great. Thank you so much. I know several students in my office love that service, so thank you very much. Does Georgia Tech have backup power should there be a power failure issue on campus?
Well, it's outside of me, but I'm very familiar with lots of so we do have a lot of our power here is backed up by Georgia Tech. Not a lot of it's city power, a good portion of it. A lot of the Greek houses, I think, are off and they work with the city power. But most of our facilities have our own backup power, and we self-contain the power on campus. On the main campus, housing buildings. There's one-offs, especially in the Greek community along First Drive, that they fall within the city's power grid. So as far as it goes power, we've got great power. That's the short story.
Great. Thank you. And I'm going to pop back over to Dr. Holton. If a student gets sick on the weekends, how is he? So one, what do they do on the weekends if they're feeling ill? And then how easy is it to get an appointment at STAMPS Health Service?
So our hours at STAMPS are Monday through Friday, 8 a.m. to 5 p.m. We do not offer weekend hours. We do offer, when students call our main number after hours, there is an advice nurse that they can speak with who can help them decide whether the issue that they're having is something that they should go to urgent care or the emergency department for, or if it's something they can manage at home until the next time that STAMPS is open. We also offer on our website, we have an after hours page that provides information about nearby urgent care centers that students can access for care. It describes their hours and gives a map location for where they're located. And it also provides information about the 2 nearest hospitals to campus. In terms of how easy is it to get an appointment at STAMPS? I think it's relatively easy for students to get an appointment at STAMPS. Right now, for primary care, when students go to schedule an appointment, they have to choose whether they need a respiratory appointment or a non-respiratory appointment. A respiratory appointment is for any complaint that could be COVID-19. And if a student signs up for a respiratory appointment, they get a test for COVID-19 prior to being seen by a provider. We are trying to manage many of those issues by telemedicine, but we will bring students in to be seen physically if we can't adequately manage it by telemedicine. Appointments in our women's clinic are relatively easy to get. I don't think there is a significant wait time for that. We did have in the last spring and summertime, we had a delay because we had decreased staffing, but that's been resolved. And right now there's not a delay for appointments. And then in psychiatry, as Dean Stein mentioned, we have had a couple of our psychiatrists return from maternity leave, and we had a new psychiatrist start at the beginning of December. So right now our wait for an appointment with a psychiatrist is less than a week. So it's relatively easy. Now I will say that STAMPS resources are going to be stretched thin this spring as we are trying to both staff our health center as well as staff our vaccination clinic. So we're going to be stretched, but we will be maintaining services to the best of our ability.
Okay, great. One of the questions was about if a person falls into the 1C category as far as underlying health conditions, will they need a doctor's note to get the vaccine, or is that something, how would we know that they actually fall into that category?
So we have not yet defined the process by which we are going to identify those that are in 1C. One way which we will do that is based on their records in our electronic medical record at STAMPS. But we will also probably develop a process by which students can self-identify. as having a medical condition that puts them at increased risk. I don't foresee us implementing a system that is going to require significant verification unless we get an indication that students are trying to game the system and are falsely reporting that they have an underlying medical condition to try to get a vaccine early. We may have some verification process that we have not yet defined, but it's not going to be an onerous. We are not trying to create barriers to getting vaccinated for those students who need to be vaccinated.
Okay, great, thank you. For students that live off campus, if they test positive for COVID, what are the available options for quarantine? And I believe that's only for on-campus students, correct?
That is correct. If a student lives off campus, if they live in an apartment off campus, they are expected to quarantine in their living space.
Okay, great. I'm going to try and go through some other questions real quick here. Looks like a lot of them were answered. So if you have any additional questions, please put them in the chat box. And if my team can go through and delete questions that have already been kind of answered, that would be helpful. So I'm kind of scrolling through here. One question
there was one question at the end, just if Dr. Holton could talk again about the specialists at STAMP, like dermatology or anything like that.
Sure, thanks. So at STAMPS, we have primary care providers, our women's health providers, our psychiatrist, and then our sports medicine physician. Other specialists, we do not have at STAMPS Health Services, but we can assist students get connected with specialists in the community. We do have a panel of specialists that we refer students to, and it's not exclusive. And if a student has a specialist that they're familiar with or that they want to work with, we can certainly assist them get connected with that specialist. But we do not have any of the specialists like dermatology, gastroenterology, cardiology on staff at STAMPS.
So we've gotten a few of this same question. Are TAs considered educational faculty or staff, or students who work in one of the administrative buildings, are they considered staff even though they're students? So some parents are asking if their student's kind of a TA or they're a student assistant, would they be considered faculty staff in that 1B, or would they still have to wait till students are vaccinated later in a later phase?
Yeah, so in our initial discussions of phase 1B and in our trying to determine how many people fall into that category, we have included student employees in our figures. Within 1B, we will prioritize groups. So student employees may be at a lower priority probably will be at a lower priority within phase 1B than other faculty and staff, but they probably will be included in phase 1B at some point.
Great, thank you. I'm going to pop back over to Chief Connolly. There's a question about your perimeter of campus, where for maybe some of the private residence halls that are on Spring Street, kind of surrounding the campus area. Where can you go? Where can you assist students who are kind of living right there on the edge? How can you help?
Okay, our jurisdiction under the Board of Regents and state law is 1,500 feet off campus proper. So off any campus property, you can go 1,500 feet from that property. So I think a lot of the concern came up with Tech Square and a lot of the activity along Spring. I know I heard from a lot of parents. We saw a lot of clear alerts that came out of that area. And a lot of that had to do with the nightlife in that area that had some serious crimes. So yes, we're working with Atlanta and we're moving into that direction to help them and assist them in that area. And we do have jurisdiction. We can move as far as U House, Square on 5th, and move into those areas. And we're going to assist Atlanta, especially as this semester goes forward.
Great. And I know you talked about this earlier, but students receive a notification if something were to happen. And that is because we want our students to be safe when that notification happens, so they're aware. Faculty and staff also get that, but parents can get that information off of your Twitter page, off of other, they don't receive that, but they can receive that in other ways.
Yeah, as we push it out to the students directly, we move it onto our socials, Twitter and all our social sites. So parents, if they connect into our social sites, they'll also see crime prevention classes that they can go online. We're doing online, like crime prevention and personal safety classes, and also they'll see all of our alerts there also.
Great. Okay. Lots of questions about the vaccine, but I think we've answered a lot of these. Some of these questions that you all are asking about the vaccine, we just don't know quite at this point, but we are trying to prepare as best we can. So I think you addressed this. The vaccine will not be, vaccines will be encouraged, but not mandated. Is that correct, Dr. Holton?
That is correct. We are not making vaccination mandatory for faculty, staff, or students, but we are strongly encouraging everyone to get vaccinated.
And then another question was, if students live off campus, once we start vaccinating students, is there a difference between students who live on campus or off campus, or they're just all considered students at that point?
We haven't really had in-depth discussions at the task force level in terms of our strategy when we approach students. I think that we may take an approach. What we know from our experience in the fall is that the rates of infection were higher in our resident students and in our Greek students. Those were places where infection spread more easily, and so we may target those groups initially, and then open it up to all students, whether they're in a dorm or in a Greek house or not. That being said, at a rate of 1,000 shots per day, that may be a difference of 1 week in terms of whether you're vaccinated at the beginning of the student population, or whether we wait until, whether we kind of tier it. It's not going to be a significant delay in terms of how rapidly we move through student groups.
Okay. Is there a fee to get the vaccine? That will be free, and is there some type of administrative charge of any type at stamps?
No. For the COVID-19 vaccine,
yes,
there is not a charge for the vaccine, and we are not charging an administration fee. It is entirely without charge to faculty, staff, and students.
Great. Colleen, I have a question for you. I'm going to pop over to you just briefly.
Sure.
If you can talk about how students get engaged and the importance of kind of knowing what's happening on campus and staying connected so that they can kind of not feel so isolated and learn more about campus life.
Yeah, there's a lot of different ways. I would say if your student is new to campus this semester, definitely encouraging them to take GT 1000. Dean Stein and myself are teaching class this semester, so that would be one way to kind of learn the campus, what the resources are, and things of that nature. The Center for Student Engagement within the Division of Student Life has a great website. After I get done talking, I can pop that somewhere into the chat. It shows different events that they have kind of going on, as well as our fraternity and sorority life department, civic engagement, and different ways to kind of engage in that way. And then I would just say taking a look there even further to like finding a student organization that they may be interested in. Maybe it's something they did in high school, maybe it's something they do currently, and that sort of thing. And I would just say to get out on campus, like it's cold, but it's not that cold. It's going to be beautiful in the spring. Please encourage them to kind of get out and be involved in that sort of thing and to kind of make connections, because it can be a little bit isolating this semester, being that we're kind of in this still kind of social distance kind of avenue. But those are a few different things I can think of off the top of my head.
Great, thank you. We just had a comment from a mom just reminding us to remind the students to please wear their masks as much as possible, whether they're out in the, and I will just tell you, I personally see when we're walking out and about, and I'm sure everyone else on the call can answer as well. Students are wearing their masks even outside. They are wearing their masks on the sidewalk to get something to eat, to go over to the campus recreation center. So not only are we seeing students wearing them inside the buildings, but they're also wearing them outside the buildings, and kind of walking around campus. They have their masks on. So that is always good to see, and we're seeing lots of students getting tested too. So that's a wonderful thing. And Georgia Tech students did a great job last semester, so we're hoping they keep it going. Let's see. I'm just going to take one or two more questions, and we're going to wrap up for the evening. Let's see.
Hey, Lacey, there is a question about the 14-day quarantine period that I can provide more information about. So during the fall semester, we were using a 14-day quarantine period. Toward the end of the semester, in early December, the CDC offered two alternative options for the length of quarantine, a 7-day option and a 10-day option. We are implementing that. We took the month of December to develop a process for providing some accountability in that process. So when our contact tracing team talks to individuals who have tested, who are a contact and therefore are in quarantine, they are given information about the 10-day and 7-day option. Students who choose to do the 7-day quarantine period have to verify that they have been doing a symptom check every day and that they do not have any symptoms of COVID-19. And they have to provide a copy of a negative test done on day 5 or after of their quarantine period to utilize the 7-day quarantine period. And for the 10-day, they just have to provide verification, or they have to attest that they have been doing a symptom check for the 10 days, and will continue to do so for the full 14 days.
Okay, great, thank you. A parent's asking about the second dose of the vaccine. If we get the supply, will that be made available? I'm not sure if we've gotten that far yet.
Yes, our plan is to provide the complete series, the 2-dose series for everyone.
Okay, and Chief Connolly, I'm going to pop back to you. How would a student kind of just, if there's something happening illegal in a student's room or perhaps in the residence halls, what should a student do to kind of report that, I guess, safely without maybe someone knowing that they reported their roommate or maybe someone down the hall?
Yeah, can you hear me? That's why the app works really well, because they can be anonymous. Give us that information without giving us any details of who they are. That's what makes the app really appealing to students.
Okay, great. So that's the Live Safe app, and they can also talk to their RA as well. Elaine put that in the chat as well, so they can talk to their RA.
Stein would like to add to that as well.
Sure.
Yeah, so let me just say that there are a number of ways that students can do that. They can start in their immediate environment with their RA or hall director and have a confidential conversation. They can contact the Dean of Students Office. You could contact the Dean of Students Office and let us know that. They can work with the apps that the Chief just talked about. So there's a number of ways that students should and or you should tell us if something really is going down that should not be going down. It's certainly illegal. We should know that, and we will do our very, very best to maintain confidentiality, but to address the issue. So that's a very good question.
Chief Connolly, there's a question that a mom has that we've kind of touched on a little bit, but she's from California, so out-of-state families, obviously, we always, when you're out of state, it's a little bit more worrisome than when you're in the state of Georgia. What can I tell my son to do or not do next week to stay safe? And we've kind of touched on that a little bit as far as the inauguration goes and the Capitol, but if you can just touch on that again.
What I'd like for them to do is actually touch base with our crime prevention folks coming from out of state and getting some familiarization with the Atlanta area. We do online classes. Our crime prevention officers love to connect with students. So we do chats, we do lots of different outreach. So the best thing is have your students connect with us, even come by and see us. So we can give them a little lay of the land, make them understand the metro area, and give them some tips from coming from California to Atlanta. And next week, I mean, pretty much go about his business and we'll let them know if activity comes towards the campus. And right now, I mean, there's nothing special a student can do for next week's activity. Stay on campus, stay within our envelope of the campus would be great, and connect with us. We love to connect with students. We love to educate students on safety on campus. Lots of programs from bicycle safety, personal safety. So just have your student connect with us. And then we could be your extended guardian here on the East Coast.
Great. And actually that's going to be our last question. Bicycle safety. There's a parent that's asking, do you have a course for bicycle safety on campus? So that's a perfect segue.
Yes, obviously scooters became the new thing, right? These e-scooters, and they're everywhere. So lots of scooter safety, bicycle safety, and all personal vehicle devices. I guess I got a new name for it all. But all these devices, from bicycles to scooters to everything, we have safety. We do a great connection with the CRC to do lots of programs on safety, and our parking and transportation unit has some training programs too. But we connect together and we love to do outreach. So yes, we have lots of them.
Thank you very much. So that's going to be our last question. I know there's a few more questions in the chat box, but we want to be mindful of people's time. So if you have continuing questions, please email us at parents@gatech.edu, and Tyler and myself in our office will be happy to answer those or get you to the staff who can answer those and get a response for you as soon as we can. I want to thank you for joining us tonight, and I also want to thank our presenters, Chief Connolly, Dr. Holton, Dean Stein's on the phone, as well as Dr. Riggle for answering some questions for us this evening. And we hope this was helpful for you. We're going to continue as the parent office to make sure we're being transparent, to keep you informed, to keep you in the know so that you can assist your student as best as possible. Thank you very much and have a great night and take care. Bye-bye.
Bye now.